So what we're going to do basically is go through what it looks like in the clinical setting, and we'll go through what the patients fill out, what the paperwork looks like, some key elements I'll point out, and then we'll go into the tab as far as the exam is concerned. And then I'll give you a few things that we do here in the practice as far as tying the exam and the patient intake sheet to generate letters to referrals, and also one specifically for the insurance carrier so the patients can get reimbursed for their services. I'll let you start.
Oh, sorry. So like Rose had mentioned, DentalWriter is set up in that nice 4-step process. And step 1 is that patient questionnaire, which you can obtain from your patient prior to your appointments. So all that documentation she just spoke of that is going to be necessary to be able to bill medical is right here in step number 1. So we have patient's chief complaints. So patient's going to let you know what's affecting them. So they're going to mark all that apply, what's really going on with this patient. And the really cool thing with DentalWriter is if I select preview, it shows us how DentalWriter is actively generating that SOAP note narrative just from the information the patient even puts in. So it's gathering that medical necessity right from the very beginning. Then you have your medical history, that Epworth sleepiness scale. And what are we looking for on your Epworth? Exactly, 10 or above, so the 11 or more, exactly. Otherwise, what do we need? Comorbidities. So we're getting that with that medical history. So all of that is key information based on medical policies, so we know you're going to meet criteria. Good enough? You can summarize a copy of a sleep study, and this is great. We have a updated feature where you can run trend reports and you can compare those sleep studies to hopefully see the progress your patient is making as they're going through with that oral appliance therapy. CPAP intolerance. Can they not use it? Is it contraindicated? So we want to know what's really going on with this patient. Like Dr. Patel told you the other day, he had a patient that said they couldn't wear it. Well, when you scared him, you know, you're a walking dead man. They're compliant now. So why couldn't they wear it? So we want to know that information to be able to treat them.
Hey, you just check a few boxes. So we can just generate something at the end?
Yep.
Just to see.
Yep.
So whatever you check as far as these screens are concerned, as from a patient intake standpoint, all this data will reflect on a narrative report that will get generated at the end.
And lastly, you have your sleep history. So just a little bit about the patient's sleep hygiene. So we're going to make John severe. This is you. Under your account, John. You're always a patient in here.
Don't do bedwetting. I've seen that from last time. I did that too. And she highlighted.
We'll be kind.
A long time ago, okay? One time.
So once your patient does complete that online form, now you're starting with that medical necessity to treat the patient. You would download and import into DentalWriter, and you can review this prior to the patient coming into your practice as well. And then you'd be ready to start that examination.
Yeah, we'll examine it. So we'll go ahead and do vitals. So we'll just plug in some information. Blood pressure 120 over.
We're gonna
20? No. So you get your vitals in here.
Her pulse is pretty low.
Yep, she works out. She's gonna have a low pulse.
The good thing here, someone asked yesterday about BMI. So in here, if you put the height and weight, then it actually automatically calculates your BMI. That was a question that came up yesterday.
Can you use your own sleep study machine just in the patient's home, or do you gotta have them actually go to the hospital and have one done?
Okay, so the question is, can you use your own sleep study machine? So the question is that it's, so you can use a home sleep unit, provided it's signed off and a report is generated or signed up by a physician. If it's signed up by a physician, I suppose you can proceed with it. But I would check with your state regulations. In the state of Georgia, as I mentioned, we are not in any position are allowed to dispense a home sleep testing unit. So yeah. Okay, so now what we're gonna do is, even though, so you have to keep up. Okay, this is how I do it, which means my staff keeps up, but they've been doing this long enough. So I will go through these screens, but I bounce around a little bit. Right, so I start from the outside, work my way inside. So we're gonna do muscle palpation. Now, you might see that some of these muscles are listed. These forms are entirely customizable. You can add, subtract. If you don't like something, you can take it off. If you want to do something I don't do, you can put it in. All right, so the thing here is it's customizable. So we're going to fake this portion here, because what I'm going to show you is what I do, but this is what we have as an example, just to kind of tie the two together. And once you do this enough, your staff really doesn't have to look at you. You know, my staff is against, when you go in the operator, she's against the wall on a laptop, keying everything in while I'm doing my stuff. The patient's calling out numbers. So we start off by the extraoral exam. Point of reference. I'm going to push and prod onto your head neck. I'm going to apply about this much pressure, roughly 2 pounds. This right here is just me pushing. If it feels like this, just tell me it's a 0. Okay? 3, it's the worst pain you've ever felt. 1, if it hurts a little. 2, if the discomfort's in the middle. Okay? Point of reference. So now I'm going to go ahead and start off. So we're going to start off with the anterior temporalis, left side. And I'm going to support a head on the opposite side. I'm going to apply about 2 pounds of pressure. Now we'll go through this here in a minute. So I'll just fly through this. But I'll put up a different slide set and we'll go through it by muscle group by muscle group. So on your left, is that pain or pressure? 1. How about up on this side? 1. How about up here?
1.
And then here.
0.
Back here, that's posterior, sorry.
0.
And then posterior here?
0.
Okay. Lateral joint capsule, anything up here?
1.
Half this strength. Okay, it's half, then you would do a muscle. How about up here?
0.
0. Open as wide as you can. Posterior joint space, anything on the left?
0.
Stay open for me. Anything on the right?
0.
All right. Deep master, I want you to clench for me as hard as you can. Anything on the left?
1.
Clench again. Anything on the right?
2.
2. Separate your teeth. Superficial masseter. Anything here?
0.
And then here.
0.
Stylomandibular ligament. Anything back here?
0.
Anything back here?
1.
Anterior digastric. Anything here?
0.
And then here.
0.
SCM on the left. Anything here?
2.
And then up here.
2.
Styloid process. Anything up in here?
1.
And then here.
1.
Occipital. Back here on the left. Anything?
1.
And then up in here.
1.
All right. Trapezius. Anything here?
1.
And then here.
2.
2. And then I'm going to go inside the mouth and do some intraoral. So I'm going to do the next 4 I typically will do on the right, and then I'll do the left. So this is where my staff knows I'm on the right side. The next 4 numbers she calls out is the right, and then we'll do the left. So the first one is the temporal tendon. Finger goes on the occlusal plane, and then you're going to go out laterally. You're going to feel the ramus. Go up the ramus halfway, and then just push. That's where the temporal tendon inserts. Anything up in here?
1.
1. Medial pterygoid is an interesting one. When we do the medial pterygoid, I'll tell you where it is, but I'll probably have you all glove up and do it to me. So you know exactly where to put your finger. Then you got to think about where the medial pterygoid is. All right, so you got the tongue, you got the cheek, you got the ramus. The medial pterygoid goes from the sphenoid plate in this direction to the angle of the mandible, in this direction. Your finger's coming from here. You actually got to go deep back into a concavity and go laterally. So this finger is going to go between the ramus, the tongue. I'm going to fall into a little dead space. Then I'm going to go inferior, laterally, and you'll feel a little crevice. And then you just push there and get the hell out. But if you hang there, they're going to gag. Okay, you in and you out. Robbie, you in and you out. Yeah, okay. Did you get some corn? Okay, here we go. Open there for me.
1.
1, okay. Buccinata origin, right up in here.
0.
0. Buccinata insertion, anything here?
0.
0. We'll do the temporal tendon on the opposite side. Anything up in here?
1.
Okay.
2.
2. How about up here?
0.
And then here.
0.
Now, lateral pterygoid. Give me advice. How do I get to lateral pterygoid? Come.
Under the zygomatic.
From the outside? Inside? Outside? Inside? Inside? Okay. So we're going to go here and then do what? Go back here and then? Does that hurt? I'm sorry. That's what you told me to do that. Yeah? Should I stay there?
No, don't say
Okay.
it. Get up.
So let's think this one through. Excuse me.
This far back.
Okay, you got your condyles. Yeah? The lateral pterygoid inserts in the fovea of the condyle, and then you have the superior fibers on the disc itself. But it goes in which direction? Medial or lateral from the condyle? Medial. All right, so it's got to go in this direction. Yeah? So it's going in this direction. So here's my cheek. Okay? Here's the tuberosity of the maxilla. I somehow have to get my finger up in that tuberosity, deep in here, just to get to the lateral pterygoid. Do you think I can get to it? Think it through. Is there enough space back there to get a finger and get onto the muscle? So we were taught in school to put your finger back there and push. Everybody hurt. Everybody had lateral pterygoid issues, but you can't get to it anatomically, not from the outside anyway. So you got to provocate it. So how do I provocate a lateral pterygoid? What is the purpose of a lateral pterygoid? How does it function? Let's start with the basics. What's its job? Opening. So how do I provocate it on openings? I'm going to have it open against resistance. Okay? So I want you to open for me, and I'm going to push up as she opens. That's lateral pterygoid. If it hurts, I ask her which side, right or left, and then score it. 0, 1, 2, or 3. Okay? The other way to also check it, that's one way, upon opening, protrusion. It's this other functionality. So I'm going to resist protrusion. I want you to slide forward. And as she slides forward, I'm going to push backwards to create resistance. Okay, that's your lateral pterygoid. We good?
So no shift lateral either way when you just open.
Just go
Okay.
straight. Okay, so that's your lateral pterygoid. It's important with sleep appliances, you check the lateral pterygoid. Why is that?
That muscle jaw soreness in the morning, and I kind of wear it. It's not.
Fair, but what's another reason? If she had lateral pterygoid issues, and I did not know this, and I threw in an oral appliance in her mouth, and I protruded her, say 60%, why would I want to know going in if that muscle's good or bad?
Because now you can protrude.
Huh? I maybe protrude slower. Give me a scenario that we didn't check her lateral pterygoid. Everything else was cool. I got in my impressions. I got the device. I put it in the mouth. She goes home. Is it likely she will call me in the next few days?
Yeah.
And if she does call me, is she calling me to thank me or to hate me? Right. And what is she hating right now?
The fit, the device. When you told her you didn't. Well, we didn't tell her obviously if that's the case. We didn't check it. So
But what would she be complaining about?
pain.
Pain, right? Pain upon awakening. And more than likely, when we ask her to get a bite back, and we ask her to show those morning exercises, it's going to kill her. Because the muscle is already inflamed. Then I contract it, and then I hold it contracted 6 to 8 hours at night. Then I expect her to take a muscle that's already affected and try to, okay, elongate it now. She's not going to be a happy camper. So we want to make sure that the lateral pterygoids are cleared, because that's the one muscle that's always working while they're sleeping with an oral appliance in their mouth. All right, so we always want to make sure you provocate or protrusion against resistance or upon opening. Now, the next thing is the joint. So fingers. This is my JVA. I'm being nice. Honestly, I'm being nice. Don't take the wrong way. I had it for a very long time. Okay, here's what we're going to do. We are going to cut our hair.
Sorry.
Okay, so the fingers will be on the lateral pole, very lightly. Okay, I'm just going to lightly touch the lateral pole, and I want you to open and close. And close again. Repeat that. And close. And one more time. Does anybody have a clicking joint here? Thank you. So we're going to use you. Layla. When you put light pressure, if you have a click, you'll feel it. Okay, you'll feel it, or you can hear it. It's one or the other. Secondly, as she's open and closing, I'm looking for either a straight path, I'm looking for a deviation, or I'm looking for a deflection. So I'm looking for these few little subtleties. The other thing that you will learn the more you do this is proprioceptively, when you have your fingers on the lateral pole very light, if they have a locked jaw, which they could have normal opening, you'll feel one condyle move, but you feel the other lag. And that's a giveaway. And then my follow-up question will be, did you ever have a history of a clicking joint on the side that's lagging? They went quiet on you at some point. And 9 times out of 10, like, now that you mention it. But what had happened is it probably locked at some point, but over time, they just kept on opening, kept on opening. So the range of motion, numerically speaking, looks normal. But mechanically, they're not tracking at the same rate as the other joint because there's something anteriorly displaced that's acting like a wedge. So you'll pick this up. And we may find someone today that maybe had a past history of a clicking joint that went quiet on her. So open, close multiple times. All right, so there's no deviation, no deflection, there's no joint sound. So from that perspective, we would not check those boxes as per se. I'm gonna grab you a light for a second. This one right here. So the next thing is inside the mouth. So I'm just gonna have it open wide, all right? So we're gonna look at tongue level, and I can see, do you mind if I say things that are in your mouth or you may fake it? Fake it?
I don't care.
Okay, so she has a tongue level of 3 with scalloping. All right, so as I say that, tongue scalloping will get checked off, tongue level of 3, sticky tongue out all the way for me, and she has a malapatia for 2. All right, so that's being marked. I'm gonna have you bite on your back teeth. So this is where I bounce around, so my assistant really keeps up with me, but she's class 1 right, class 1 left, so we get that marked. Wisdom teeth are gone. She has a vaulted palate, soft palate drape, oval is within normal. If she had tonsil tissue, I'll say, go ahead and say ah for me. Keep on, say ah for me. Keep on going, keep on going. Grade 1 on both sides. All right, close the rest for me again. And then we'll look at the dentition. Is there any fractions? Is there anything else I need to make any comments on? And things of that sort. Open them again. Now, what I'm also plotting here is to see if she has any dental crowns. Why would I want to know if she has any dental crowns?
It's the condition of the crown loose because you're going to put an appliance on there. If something is loose or not in good condition, it's going to create another problem.
Right, that's 1 or 2. Robbie, can you do me a favor, bud? You know in the operatory, facing the wall, the top drawer, could you give me a ruler, please? I'm going to measure a range of motion as well, right? So normally the blood pressure, range of motion is already taken care of by my assistant. So by the time I walk in, all I'm just doing is the exam. I will review the test results, review the reason they're here, review why they could not comply with CPAP or the reason they want to try oral appliance. I'll finish up my exam and I'll go over a few more things that I would tell my patient, but let me just go and get a range of motion so I can get the overbite, overjet, and all these aspects keyed in as well. So the reason I want to know if there's crowns or not is to just let them know that, hey, look, I'm going to put you in oral appliance, but the device is not a crowbar. It's possible one morning you take the device out and a crown pops off. If that were to happen, don't freak out, just go to your dentist and get it glued. But I want them to know going in. So I want to make sure, is there or is there not any crowns? All right, bite your back teeth.
Do you tell them to make the light where they have the crown?
No. Oh, so with veneers, I'll say block it out for me, as an example, right? Or I'll use dual laminates. So there's not much friction on those teeth. So you can do things of that sort, correct. 3-3 overbite, overjet, open as wide as you can. So 53 opening, bite on your back teeth, slide your jaw forward, all the way forward, all the way, keep on protruding, keep on going, 8 protrusion, bite on your back teeth, open just a tad, go to one side all the way, and then the other. So 15 right, 15 left, range of motion. Okay, so we get that keyed in. All right, so let's see. We've got the airway exam completed. We take a look at a dentition. If there's radiographs, I kind of look over the radiographs. Can we do an X-ray radiographic report? Is there one in here? Imaging? Okay, that's okay. Let's go to assessment in the meantime. So with assessment, I want to say, all right, this person had a sleep study done, check-up sleep study, all right? The diagnosis was given by whoever the physician was. And this beautiful thing about this box is as you start inputting names of physicians, you start getting a drop-down box of your referrals in a way. So those names will be pre-populated. So say Dr. Smith or CC Nierman actually diagnosed her with having sleep apnea. The diagnosis, hey, dog knows better. If the dog does this at night, you're snoring. Right? Obstructive sleep apnea was the diagnosis, pretty much what we're going to be going with, right? Impressions and bites. So what did we do? We took impressions today. We took photographs. Maybe we did today. Bite registration was taken. And then you can jot down, if you wanted, for a mental note, what you exactly did. What was the retrusive measurement? What was the protrusive measurement? What did you set the device at? So you can keep a chronological, numerical representation of what that might look like. Right? Then your plan of action. So my plan of action is, so I'm going to deliver an appliance. The device I'm going to give her would be, is there anything there? Let's go with the Oasis or Somnament or whatever you want, or Dynaflex. Let's put Dynaflex in there. Yeah. Let's put Dynaflex. Make sure we spell that right. There you go. Okay. Now, the other thing I like to check off is if you just scroll here. Let's see, where is it? I've discussed the mechanism of snoring and obstructive sleep apnea and reviewed the risks, limitations, benefits, fees, and reasonable expectation of the use of mandibular repositioning device. So I pre-populate that sentence. And then there's another thing. I will send the patient back to the physician to get a test done to validate that device is effective. Maybe it's customized in mine. So I have another paragraph that basically says, look, when this person is subjectively improved, I'm going to send it back to their physician to get them tested. So I check that box off. So when this letter goes to their physicians, they know that this person's coming back to them to be tested. So I'm just planting the seeds. And the patient is aware that when we get to that point, you are going to go back to the doctor that actually diagnosed you, and you are going to get a follow-up test. And that's going to be a distinguishing factor whether we need to still advance you or not. So we're planting all these seeds here. Okay, so imaging, what do we do on them? Say we did a CBCT or a PAN is typically what I will do when I do my sleep appliances. So this way I don't have to get it pre-authorized. So I'll definitely get a CBCT scan, but I will just build out the panoramic view. I will take a look at the entire volume. And there's an imaging tab somewhere, which is beautiful because you can then just make comments about what you saw in the x-ray as well. Coronary hyperplasia, antegonial notching, maybe she had a chin implant, fixation screws, radioplasty in the right maxillary sinus, a deviated septum to the left, just check these various aspects off so that you made the comment that you actually even reviewed the x-ray. And then I would finish up with a paragraph at the end. If there was things that I saw on the x-ray that demonstrate she needs to follow up with an ENT, a referral was provided to ear, nose, and throat to assess the right maxillary or radioplasty she had, or the deviated septum, or whatever the commentary. So it's just in your plan of action. So when this letter gets generated, all the things are listed in a SOAP format. All right, you want to generate or?
So we're going to generate that narrative report. So you can send an after visit summary to your patients. You can use the contact list that you're going to form for your office specific for all those physicians, insurance companies. So you can keep that referral base going by sending narrative reports to any physician that's in contact with the patient, those referring physicians to you as well. So we'll make sure that we refer back or send that letter back to Dr. Nierman here. And then we're going to generate that SOAP note narrative report. So now DentalWriter and Microsoft Word will go ahead and generate that narrative.
Oh, you're 50.
8.
So this is that real nice SOAP note narrative, pulling all of that medical necessity from the patient questionnaire, from the examination, onto that nice letter that you're going to be able to submit to your insurance companies for medical necessity for the treatment and send to all of those referring physicians. The really nice thing on our SOAP note report is that it does include all of your ICD codes and CPT codes. So we'll also tell the exact same story that your claim form does as well. So we have that really nice report, and all the documentation that we know insurance is looking for is right on this letter for you. So you know you've met that policy criteria and insurance has everything they need to approve your pre-authorizations.
Question. Saves a lot of time. Once you get all that stuff keyed in, everything's like a checkbox, right? So for the most part, you're just checking boxes. And you can add stuff that you do, like, CRCO, whatever that is. Put that in there if you want. Whatever, however fancy you want to be, you can. Okay, so that is basically what the whole process literally looks like, Chairside.
So to finish the 4-step process, now that we have that narrative report, you want to get paid for what you just did, correct? So you want to create that claim form. So we're going to slow the doc down. We're going to generate that CMS 1500 claim form. So now that you've learned how to build that, just like creating the narrative in DentalWriter, it's going to populate our claim form as well, so that once we get this generated, then you're ready to submit it to insurance and you've completed that case. So now we have our completed CMS 1500 claim form. So all the information from the patient's chart gets pre-populated into the correct fields. So we know that everything is going to be successful in billing it to the insurance. We have your diagnosis code. It just automatically pulls that right through. All of your CPT codes in box number 24. What services you've completed, so you know what you want to get paid for. So that's what you're going to be looking for into billing that to your insurance company, that you have all that information already here. So this claim right now within 2 seconds, has been ready now to be submitted to an insurance company. You're going to get paid.
Yeah.
Any questions on process?